To discuss about a case history which is about depression. Okay, in this we are going to see about what is depression and what is the chief complaint of that patient and the mental status examination, what is the result of that and what are all the chief complaints did the patient have faced throughout and what would be the treatment process and what is the outcome. Yes, shall we do this? Now Lakshmi will be reading out the detailed history of the patient. Yes.
The initial of the patient is MS, age 20, occupation and marketing executive, marital status single. Chief complaint, Sarah reports persistent feelings of sadness, hopelessness and worthlessness over several months. History of present illness, onset, symptoms begin after her breakup, gradually worsening over time. Duration several months. Characteristics, loss of interest in activities, changes in appetite and sleep, difficulty concentrating, and physical symptoms.
What are the chief complaints? One second, repeat that.
Chief complaints, loss of interest in activities, changes in appetite and sleep, difficulty in concentrating, and physical symptoms.
Okay. So this is all related to hopelessness and helplessness, and which she may face like nothing is there for me and everything is over up to me. Okay? Yes.
Past medical history. Previous mental health issues non-reported. Medical conditions non-reported. Family history. Mental health history. Mother has a history of depression. Social history. Support system. Friends and family are supportive, but Sarah feels isolated.
So in this, like family has the Sarah has her family influence, that is genetical influence in the depression. So she may experience much more depressive symptoms comparatively from others. Okay.
Mental status examination. She appears disabled and tired. Mood depressed, hopeless, and worthless. Thought processes are negative, self-talk, self-blame, and catastrophic thinking. Cognitive functions difficult concentrating and making decisions. Assessment and diagnosis. Clinical interview that confirms symptoms and diagnosis. Standardized rating scale. Beck depression inventory. DBA score indicates moderate to severe depression. So she has a major depressive disorder.
What is the treatment process?
Treatment plan is cognitive behavioral therapy, which is known as CBT, to address negative thoughts, patterns, and behaviors. Medications, selective serotonin to be inhibited. Lifestyle changes, regular exercise, social support, and stress management.
Okay. Can anyone say about the symptoms? What can be the major symptoms of depressive patient?
Ma'am, they have a lot of emotional, behavior, and physical symptoms, cognitive symptoms also.
Okay.
In emotional symptoms, they will feel a lot of, they feel like they're not worthy, they feel a lot of worthlessness, they feel hopelessness, they feel like they're useless and all. In behavior, they will start they will avoid going to social activities. There will be a different pattern in the way they communicate with others. Then in their physical pattern, what happens is they will not be able to eat properly.
Yes.
Their sleeping pattern changes.
Yes.
They will not be able to, have a proper food system. Like the whole digestive system also will be not proper. Then in cognitive, they will be their thinking process will be slow. They will be always having negative thoughts. They will not be able to think properly. Whenever they are said, when they are asked something, they are not able to give a proper response because of the negative mood.
So initially, a client appears to us, to a counselor or a psychologist. We should first rule out what are all the major things which he or she has. Like we should collect the symptoms. We want to examine the mental status examination. Like we should collect the general history of the patient and what all of the symptoms is presenting in the particular person for that particular person. So once we collect out the symptoms, like major symptoms would be, as she said, the patient may feel very helpless and hopeless and worthless. So on this, like tired, physical symptoms may be like feeling tired and insomnia, like he or she may not let into the sleep, or they not be interested to sleep or take any food like that. So these are all the major symptoms. Once we diagnose with the symptoms, we will move on to the treatment process. For the basic treatment process for the depression patient is cognitive behavior therapy, which help to change their behavior. Okay, which help to change their behavior through the pattern of thinking process. Once we change the thinking process, we can change the behavior. So, cognitive behavior therapy, cognition itself is to do with our thinking process. Once we change our thinking process, automatically our behavior will be changed. So, for identifying the level of depression, the patient have been used Beck's depression inventory, which is given by Dr. Beck's. Okay, so cognitive behavior therapy is the solution for depressive patients. Thank you.